Hello everyone, so this video I'm going to be talking about my experience inpatient at the hospital where I had 2 weeks on the floor, on the pediatric floor, and 1 week in the NICU, the neonatal intensive care unit, and 1 week in the PICU, the pediatric intensive care unit. So for the first 2 weeks on the floor, in the pediatric floor, it was literally RSV cases. As you guys heard, the RSV cases spiked up, where most hospitals unfortunately are not able to admit more patients because most of the beds are full, the rooms are full. So some patients are they're transporting them with the helicopter to different states to seek medical attention. So please stay safe and keep your children safe. The way things were on the pediatric floor is basically we would wake up every morning. There's a sign-out sheet for the patients that were admitted overnight or patients that have been admitted for 3 days. I would go let the resident know that I'm going to be seeing patient 1, 2, 3. They would approve. I would go see these patients, take the history, perform the physical exam, come back to the resident, present it to the resident. Me and the resident would be working on a plan for this patient, and then we wait until rounds. So rounds is when you and the attending and the residents go to every patient's room and you go round on the patient. Basically, you present the patient in front of the attending, and the attending updates the family on what's going to go on, what's the next step for the patient. Overall, it was an amazing experience. I seen a variety of complaints, anywhere from infection to psych to neuro problems, cardiovascular problems, congenital problems. It was an amazing experience. Going there to NICU for a week, which is the neonatal intensive care unit, where most of our patients were premature patients, where they were born like 28 weeks, 27 weeks, 30 weeks. And basically we have to keep a close eye on these patients, monitor how they're growing, how they're feeding, any complications. We just keep a close eye on them until we're comfortable to discharge them. The way the flow was there was the same as the pediatric floor, where I was assigned to a patient and presented to a resident, then to an attending. Overall there, one nice story was like one day I was assigned to 3 patients that I have to go present to the attending, and when we were going rounding, another attending pass by to say hello. He was saying hello to the team, and they asked him, "Oh, what are you doing on this floor?" He was like, "I have a C-section that I have to go assess a newborn." And I was like, "Oh, that's so interesting." And he looked at me, he was like, "Oh, do you want to come with me?" So I was like, I'm looking at my attendant, I was like, is that a good idea? Can I say yeah? But I have to go present the patients. And he was like, "You know what, go." My attendant told me, go fast, but come back. I was like, okay, I'll be quick. So I go with the attendant, I go scrub in, run to the OR, and there it was just a different experience. It is so hard for me to put it in words to let you know how I felt in that OR. It was the first time I experienced and I see a newborn in a C-section, like a newborn literally coming from a different environment where he was in his mom's womb to like where, like, I don't know how to say it. I literally do not know how to put it in words. It was a different experience. The nurse gave us the baby where he was moving, and like we put him and we started to assess him and perform a physical exam on him. And literally I was like just like looking at the baby, and I was like in a shock. I was emotional. I was like so happy. It's just a different feeling. It's just an amazing feeling. So even the attending was looking at me, and he was able to see my smile. He was like, "I have never seen anyone with a bigger smile." He was able to see my smile through my mask. That's how much I was smiling. And he was like, "Go start stimulating the patient." So we were trying to like score the patient. We do an APGAR score, where we look for the appearance of the patient. A stands like for the appearance of the patient, and like basically their respiratory rate, their reflexes, and we just look at their pulse and all that, and we score them based on that. So we start stimulating the baby so he can cry and see like everything is functioning. We do a physical exam. and we look for any abnormal signs, and it was just an amazing experience. I leave the room, go back to my team, and then go present my patients. And that's how things were the flow. I learned so much. I learned how much is expected for a baby to grow daily, like how much weight they should put on every single day, how many feeds, how we maximize their feeds, how much they're expected to, how many bowel movements, how much should they be voiding. It was an amazing thing to learn. Overall, it was a nice experience. Then from there, I had 1 week at PICU, Pediatric Intensive Care Unit. That's where like the most patients that would get admitted to the hospital and they needed more attention, they would go to the ICU. And we've seen a lot of patients. Like I would walk in like at 5 a.m. and see in the middle of the hallway, like running to the room and the patient's getting intubated. It was very intense. I enjoyed it so much. Like I loved it because I liked that like I like that like intensity. I like that like time. I had to be like active. It was just like, it was amazing. And we had an amazing attending that she kept everything organized. As much as it was very stressful, it was a lot of patients, but she had everything organized. She was just like all the time calm, and she was like managing the patients in the best way possible. Something that I seen there which was very sad, we had a patient that came in from the emergency department. They were admitted to the PICU, and they came in because basically they had an asthma exacerbation that caused them to have difficulty at breathing until they lost conscious, and they lost their heartbeat, and they came to the hospital. In the ER, they were able to resuscitate them. They performed CPR. They got a heartbeat back, but the patient did not wake up, sadly, because it was too late, where they had anoxic brain injury, where some parts of their brain were damaged due to the cause of lack of oxygen to their brain. It was very sad because it was a very difficult decision. Basically, two options: whether to trach the patient, where they keep the patient on a ventilator and send him home, where at home he is at risk of aspiration, infections, and they need close monitoring at home, or remove the ventilator. It was a difficult decision for the parents to make. Maybe something that I learned from there: sometimes for a child, it's hard to understand the severity of their exacerbations of a certain disease, because for a child, it's hard for him to complain or to kind of let you know what he's feeling or what she's feeling. So sometimes we have to look at specific signs or alarming signs that should guide us to, okay, this is an alarming sign, I have to go seek extra attention. Whenever you're having a patient, or if your child is having difficulty breathing, where they are having belly breathing, you see their belly like going forward and backward, and they have like subcostal retractions, like they're having retractions right here, or intercostal retractions where like even the ribs start showing, and they have some trachea pulling, where they're like kind of like moving their neck and like their trachea to like kind of pull on it to grasp some air. These are signs that they're having difficulty breathing, and these are signs that they are using accessory muscles to be able to get adequate oxygen to their lungs. This is when we have to go seek attention, medical attention, because these are alarming signs that basically our child is not able to breathe comfortably. There was a lot of times it was very difficult for us, and even like when we want to approach this case, it was very like hard. Like there were some certain words we had to use, and some certain words we were not able to use, because you don't want to give false hope, and at the same time you don't want to guide the parent's decision to a certain choice. So you just want to feel with the patient, understand the patient, and provide all the facts and let them choose and what's the best for the patient. That was overall my experience inpatient at the hospital. I hope you guys enjoyed. If you guys have any comments, any questions, comment down below. Don't forget to like and subscribe, and stay tuned for more videos.